And I want all of you guys to write down the feedback. Yeah? When you listen to anybody, write the feedback and compare your feedback with my feedback and tell yourself, because sometimes I can give a feedback and when you compare it to yours, things that was not mentioned and you forgot as well. So that means that you will forget as well. So that's your weak points. Do you understand? So okay. Dr. Afshin. Dr. Afshin?
Noshin?
Yes,
hello?
Doctor. How are you doing? Okay?
Can you hear? Yeah, I'm fine. Thank you, doctor. How are you?
I'm fine. I'm fine. I'm fine. Where are you from?
From India.
India. Yes. Kerala?
No, Mumbai.
Mumbai. I only know Kerala. That's why I said Kerala. Okay. Very important. Can you write down, please? Write down.
Sir.
You are an FY2 doctor. You are an FY2 doctor.
Okay.
In the orthopedic department. Mrs. Julia Robert. Julia Robert, 65 years old. Presented 3 months back with right wrist fracture. So she presented 3 months ago, right wrist fracture. She has been successfully treated. DEXA scan was done as a part of the follow-up investigations. DEXA scan was done and shows osteoporosis. She has come today for follow-up, talk to her, address her concerns. She has come today for follow-up and discussing the scan results, talk to her, address her concerns.
Okay, sir.
Okay. I'm ready when you're ready.
Yes, sir. 30 seconds.
Guys, it's a very important discussion on, as I told you, minimum 2 stations or 3 stations, test result. But what's important for me now is how much history should we take and what is the structure and how much management. Test result stations. Wallahi, wallahi, minimum 2 stations in your exam. Test result. Same, test result. Follow up, test result biopsy, test result, anything. Any test result in the exam. How much history should we take? Dr. Omar Sobaki, is he online?
أنا معاك يا باشا ما تقلقش.
I love you. Wallah, I love you. I don't know what will we do without you.
شكرا.
So, Dr. Omar, start now the bell and 8 minutes, okay?
The time starts now.
Hello.
Perfect. Hello.
My name is Dr. Noshin, one of the doctor working in this department. Can I confirm your name and age, please?
My name is Julia Robert, and I'm 65 years old.
How do you like me to call you?
You can call me Julie.
Okay, Julie, I can see from my notes you came today for the follow-up. So I can for your test results. Am I right?
Yeah. I had some scans done, and that was after I had the fall. Okay, I broke my wrist. Thank you. I broke my wrist 3 months back, and it's been managed surgically, and now I'm just coming for the follow-up of my scans.
Yeah, I see, Julia. Like I can see you had this fall, and that maybe must very scary for you when such things can happen. How are you doing now?
Well, I'm fine. I mean, I'm getting better with the physiotherapy, and things are getting better. Yeah.
Yeah, that's very good to know. And how's your hand?
Yeah, it's okay. My wrist is fine. I started
Okay,
moving it now. It's okay.
okay. Any pain by on the type of movement?
Well, some stiffness, after surgery, some stiffness.
Okay, and how are you coping with this?
Yeah, it's fine. I've got my partner. My partner is looking after me, and because it's in the dominant hand, so my partner is really doing a good job looking after me.
Okay, that's very good to know. You had a very caring partners. I appreciate that. So yes, Julia, I have your test results available with me, and we are going to discuss on this. Okay, but before that, just can we have a quick chat about your general health?
Yes, doctor. Yes.
So you mentioned to me you have this fall 3 months back, and you came to the hospital and they did some surgery on you. Can you remember how was the fall? Like how you fall down?
Well, I mean, I just got pushed, and then I fell on my wrist, but my wrist is okay now.
Yeah, okay, that's good to know. Apart from this fall, do you have any other falls?
No. Just I had fall like previously, like 6 months back, but again, everything was fine.
Okay, so you have fall 6 months before also. How was that?
Yeah, but everything was fine. There was no fracture. Everything was okay.
Okay. So how are you doing? Like any complaints at this moment?
No. I'm just going with the physiotherapy, and things are okay with the physiotherapy.
Okay. Any medical condition you diagnosed before?
Well, no, not really. I mean, not really. I mean, apart from diabetes and high blood pressure, they've been managed, and I mean, everybody has them. So just chronic conditions being managed under control. Nothing else really.
Okay. So as you mentioned, both are under control. Are you taking any medication so far for diabetes or hypertension?
Yeah. I'm taking insulin for my diabetes, yes, and I'm taking Ramipril for my high blood pressure, and it's under control.
Okay, that's good to know. By any chance, do you have any surgery in the past, like any surgery including your womb or something like that?
Well, yes, I had my ovaries removed. Yeah.
Okay, and can I know when was that?
Just a few years back. I don't really remember exactly, but yeah.
And have you taken any medication for that after the
No,
ovaries
no,
was removed?
I'm just on some medication, hormonal replacement therapy.
Okay. Okay. Any
But apart from
apart
this,
from okay, that's thanks for sharing this. And any family member of your family has any medical condition, like including any bone problem or such things, which you have recurrent fall history?
no. They all fit and well.
Okay. So Julia, before I move further, do you have any specific concern to apart from your results?
No, not really, no.
Okay. So I have the results. I'm going to examine you. Just quick question about your lifestyle. Do you smoke?
Well, I don't really. I don't like smoking.
Okay. And how about alcohol?
Well, I do drink, every now and again, every weekend.
Okay. And how about your diet? Can you tell me in detail about your diet?
Well, I eat pizzas, burgers. Yeah, I love my
Okay.
fast food.
Okay. And by any chance, do you love any dairy products? Do you able to eat that in daily basis?
And I hate, no, I don't like dairy product. When I was young, my mom used to force me before going to school in the morning into drinking milk, and this milk used to smell, it was like smelling like as if it just came out of the cow. And she used to force me on drinking the milk, and I don't like milk. I don't like cheese. And when I grew up, when I had the control of my decisions, I just refused. I don't like cheese. I don't like any dairy product. No.
I see. Like, yeah, I can understand like what is your experience about dairy product. No worries, we are going to discuss it shortly. Okay. Now I would like to examine you, Julia. Will that be fine with you?
Yeah, fine.
Okay,
Yeah.
I will take your general physical examination observation and just have a quick look on your rest.
2
Okay.
minutes remaining.
Okay.
Okay. Now, Julia, coming to your results.
Sasso. Yeah.
Okay, so coming to your results,
Yes.
as you mentioned, you had a fall 3 months back. Before then, you had a surgery. After that, you also similar episode 6 months before that. And we did your
Yes.
results, which is called DEXA scan. Do you know what is DEXA scan?
Yeah, it's a scan to check my bones to see if there's any problem in my bones. Yeah, that's what they
That's
told
very
me.
correct. Yeah, that's very correct. So there, like Julia, so I'm just afraid to say that your test, like the results are showing your bones are weak.
My bones are weak. Yeah, it's expected because of my age, I think.
Yeah, that's a very like, yeah, you are right. Apart from this, I've like when you mentioned few points, your history, in that I found there is few points which can be also the cause of your fall, and your like bones are weak.
Okay, but why am I having these weak bones?
Yes, coming to that. So as you mentioned to me, your ovaries were removed, right? So and you're taking hormone replacement therapy. So that is the one of the cause like which lead to weak bone. Are you
Oh,
following
right.
me?
So, yeah. How would you
And
manage me, doctor?
yeah, that's a very good question. So there are few things like which you need to do. There are few things which we can do, and by working together, we can help to manage this condition. Would you like me? What would you like me to start first?
Yeah, things that you can do, please.
Okay, so we can give you some medication which is help to straighten your bones. Okay, like
Okay.
bisphosphonate. Are you aware of that?
Okay. All right. Okay.
Okay, so you need to take this medication on daily in the morning. Shall I go ahead to say
Okay.
you how?
Yes.
Okay.
Yes.
Okay, so you need to take this medication daily in the morning with a glass of water in the sitting position in
Time is
empty
up.
stomach. Okay.
Carry on. Yeah. Yeah. Okay.
Okay. So to take in the morning in the empty stomach in sitting position, and you need to keep sit till next 30 minutes and do not eat anything. And it would be great
All
if
right.
you rinse your mouth properly after this. Okay, because
All right.
sometimes it will affect your teeth. Okay.
Okay.
Apart from this, what I advise you, Julia, as you mentioned to me, like you have, you love burgers, you don't like cheese and dairy products. I can understand it must be very like to eat such dairy products and
Yeah.
all this
My
may be
my
something
my mom is
uncomfortable for her.
Yes.
Yeah, I can understand, but it would be advisable because it's highly recommended if you can try, because this is very important for your bones. They help to
All right.
straighten your bones.
All
So
right, doctor. Are there any like exercise I should avoid?
yeah, so you can avoid the
Any hobbies?
like, sorry.
Anything I should do? Anything I should avoid when it comes to exercise?
Yeah, so what I can say, so as you can do some bone stretching exercise like uh, walking upstairs, okay, and you can
Yeah.
do some
I love
weight bearing
I
exercise.
love I love belly dancing. Can I do belly dancing? Can I carry on?
It is not advisable to carry a belly dancing because your bones are weak. What I can suggest, I will refer you to the physiotherapist, exercise therapist, who will help you to understand what best exercises for you.
Mm-hmm.
Okay, they
But
will
I
guide
love
you
my belly
better way.
dancing, doctor. I love my belly dancing, and
Uh,
I love
so
it.
in this
My
case,
partner might split up with me if I stop dancing for him. He loves to watch me dancing.
okay, I can see. So what I can suggest, I will you can. I'm not sure. Okay, so I will refer to your physiotherapist. They will guide you in better way. Or I will ask my senior to come and discuss with you further.
Thank you very much. Thank you. Thank you very much. By the way, perfect consultation, perfect start, perfect rapport, perfect history, perfect management, perfect communication skills, perfect everything. I have to say. I don't know if you noticed or not. Oh, no, it's fine. It's fine. I elongated the station. I elongated the station. I have given her plenty of stories in the middle. Okay. So the time management is perfect as well. Even though she took like 9.5 minutes or 10 minutes, it's fine because I put things up. I had a full 6 months back, and I was just talkative and chatty, and like the consultation is perfect. Time management is perfect. However, I have dropped something in the middle. In the middle, I have dropped something to check the active listening and to show you, all of you, the active listening. You could, guys, you will be shocked. Sometimes you could start a station and the station is going somewhere, osteoporosis. All of a sudden, the whole station changes. And you find yourself going somewhere else and getting full mark. While everybody else coming out and telling you, brother, have you seen the osteoporosis was very direct, very straight. I love the exam. Osteoporosis, seriously, you will hear this a lot. Osteoporosis, brother, it was perfect. I loved it. It's from the notes, and it's written in the notes exactly. And Blab 2 is like very, and then you come out and you say to him, oh, osteoporosis. Oh, but I mean, it was something else. What do you mean, brother? It was NAI, I think. I think it was NAI. Yes, it's osteoporosis common, but your patient is your patient as a whole. He's not your patient. When you have a patient, you are thinking of everything. It's a consultation. There was an incident that a child died of abuse in UK, and it's all over the news. All over the news in UK at the moment. And this child was missed from a visit to a visit to a visit to a visit to a. So when he goes to the GP, an elderly or a baby, or if it's missed, trust me, you've had it. So my point is, the child was having injuries and nobody was picking it up. So when you have a patient, he is your patient as a whole. So I told her, I got pushed. Yes. I got pushed, and that's it. So she didn't pick it, but she was so lovely in the station. Everything else was perfect. So I said, help her again. 6 months back, I had another fall, but I was all right after the fall. I was just trying to trick her. I was all right, no fractures. But how did you fall? I could have said to her, I was pushed as well 6 months back. You understand me? So you can drop something in the station and you change the whole scenario. Wallahi, one of the most important skills in Blab 2. The good thing that not many places try to embed this skill. People are just osteoporosis, that's it. But we try now our best to, get the active listening going on with you guys and take advantage of this, because nobody does. People go, oh, yes, I have in my script, in my station here, osteoporosis. Yes, but no, things will be dropped in the middle here and there for you to pick up and see. You understand? Don't worry. Many things will be there that doesn't make any sense, but one word can make sense. And one word, I got pushed. 65 years old. So she has done a perfect station osteoporosis. No comment. But I have made it. Yes, osteoporosis. Yes, beautiful station from outside and spicy from inside. So inside the station, some spices here and there. So anyway, did you pick it? Do you know?
Yeah, the cause of fall needs to be checked.
That's it. The cause of fall, as a, but don't go into NAI because it could be an osteoporosis. It's osteoporosis. But don't worry, I have given her the clue. And then the exam, don't worry, nobody will hide it. But they will say it once, as I said, and that's it. So it's not going to be hidden. If I want to show you that there was something going, you will hear it, as I said to her. Do you understand me? Because I don't want you to think, oh, now so any osteoporosis, it could be NAI. No. I'm just saying active listening. If there is something, it will be dropped in the middle. Online doctors.
Yes, doctor.
Did you pick it?
Yeah,
did you pick it, guys? Did you pick it? Did you pick it?
I didn't.
Yep.
You go there. Don't worry. No, go there. Go there. Yes. Yes, go there. If you get given something in the station, don't leave it. Go for it. Because if it wasn't important, they wouldn't give it to you. So please, if I give you something in the station, follow the patient. If you get given something, please do not leave it. Do not drop it. Go for it. Online doctors clear.
Dr. Mo, I have one question regarding this case, regarding the
Yes,
domestic
bro.
abuse. Okay, so I do understand that we don't involve social services unless they are in the extremes of age, for the principle of because they cannot fend for themselves and they are vulnerable. However, this patient may be.
This will be if it's NAI, I will inform social services.
Yes, I understand, but should it be obligatory or should I ask for the patient permission?
100% obligatory. 100%.
Okay.
100%.
Because she's
Guys,
osteoporotic.
yes. Yeah, no, I'm not admitting her for osteoporosis now. I mean, a patient here, extreme age, guys, when it comes to NAI, non-accidental injury, if it's a child, obligatory admission. If it's elderly, obligatory admission. What if 35 years old? She's got mental capacity. She knows that she's in danger. Offer her help, offer her admission, offer her, you know. But if she does not want, you can even safety net her by giving her, you know, we're gonna give you help line. You know, you can ring the police if things go really bad, but you cannot force admission. What if she is pregnant? You do not force admission. If she is pregnant, even if she's pregnant, the baby is inside. I only care if the baby is outside. The fact that she's pregnant, I cannot force her to be admitted. You understand? So, but if she has a baby, can I keep the baby? Yes, I can. You understand? So the baby has no right as long as he's not out. In the womb, fetus, there is no right. There is no person there. However, make sure you advise her, make sure you tell her about the risks. What do I mean by the risks? The risks of losing the baby because of the abuse. You understand me? So go through the risks with her of losing the baby because of this abuse. Tell her about the risks. Always ask about something very important, emergency plan. Online doctors, always ask about emergency plan. What is the meaning of emergency plan? Very beautiful point. I mean by emergency plan, if things go wrong, do you have any plans? If things go wrong, that's called emergency. So if the lady is pregnant, you do not force admission. No. Yes, she's an adult. She has mental capacity. She knows, but always walk with her through the risks of getting abused while she is pregnant. No, doctor, I know the risks. It's fine. Tell her, okay, it's fine. You can go home. But any emergency plan, if things go wrong, do you know you have helpline? We can offer helpline. The police, you understand? Yes, which is safety netting. Perfect. Online doctors, that's as yes.
Can I ask which age is considered as geriatric age in UK?
In UK, 60. Over 60, 65, 62, 61, 68, 60. You know, over 60, go for it. Okay. However, let me make your life easy. Okay. In PLAB 2, if they want, and remember this carefully, if they want to bring an elderly getting abused, it will be always 88, 89, 90, 92, 87. They will never bring an age where it will always be over age. Clear, doctor?
Yes, clear.
And I said,
Dr.
very, very young, very, very old. Think of NAI. Very, very young, very, very old. Think of, please, guys, wallahi, PLAB 2 is beautiful. If you understand it as I'm telling you now. Beautiful, you know. A female, 35 years old, think of P4. Very, very old, very, very young, abuse, always think of NAI. Things like this, you know, when people memorize stuff, it's so tough. You know memorizing now. You have a structure and you know everything. And again, you are using your brain, you are using general rules. Very old, I will think of NAI. Very young, I'll think of NAI. She's pregnant, so what? The baby's inside. When the baby's out, I'll think of any NAI case. What is the most important part in history? NAI equal environment. Who's there? How's the relationship? Who do you live with? Your partner. Who's the baby's father? Is he the biological father? the boyfriend or whatever. You understand? Because this lady, she might have, for example, another person who's getting abused as well. Okay, so that's when it comes to NAI. Covered. So NAI, what is your history? Environment. That's your history. NAI, what is the admission? When to admit? By force. Section 2. It's called Section 2. By force. Very, very young. In between? No. But even though it's no, please, risks of not being admitted. Emergency plan. Always emergency plan. Okay? That's a very important topic. In UK, because, guys, you know why NAI is important topic in the exam? You know, always, PLAB 2, I can predict what comes in PLAB 2. I can predict what comes in the exam every day. What do I mean by I can predict it? I don't predict the station itself. No, I predict the topic. NAI is a must. Why NAI? Because back home in Egypt, Pakistan, India, we don't have NAI. We don't. I'm serious. We don't have NAI. Okay? If a wife is getting abused and she tells her dad, he said, your husband, you have to listen to your husband, you know? He is your husband. He can do anything. No NAI. If a female goes to a doctor and her family brought her to the doctor, okay? And this happened in front of me. If they brought her to the doctor and she's very, you know, psychologically not right. So then the doctor say, okay, I want to speak to her. Everybody out. That happened in front of me, unfortunately. Everybody out. Then he speaks to her. So what happened? Tell me what happened. You know why? You know, like, you know, you're feeling heart racing. You're feeling this, that. Well, doctor, because I split up with my boyfriend. Right away. He stands, open his door, come and take your daughter. Raise her properly. Raise her properly. She's crying over a boyfriend. You know, she's not well brought up. Take her, you know, teach her morals. Seriously. What's going on? So that's why they write NAI here, because the GMC smart. NAI is a must in the exam. If you miss it, and you know why it's a must? Because we don't have it back home. And if you miss it, this person will die. It could be the last time he will come to you. What else is important for the exam? STI. I have never heard about STI in Egypt. It is there, but you were working. I'm saying it's not as common as here. That's why STI must in the exam. Really must. You cannot pass through PLAB 2 without STI station. You cannot pass through PLAB 2 without NAI station. But back home in Egypt, India, diabetes, we are all diabetic. So in Egypt, what's common is diabetes. That's why you have all those diabetic cases. But in UK, you can have the PLAB 2 without diabetes. But MI and the stroke important. So my point is NAI is a must. When to admit is a must. If you have a station, NAI, and you don't spot it, and you don't admit when admission is needed, you're gonna fail. Even if you do everything else is perfect. Because that means it's life-threatening. So that's the NAI. Doctors, online doctors, clear. Clear NAI? Clear NAI?
Yes, doctor.
Yes,
okay.
doctor.
Put this on the side and let's talk about osteoporosis, because now we need to just blend two stations together. Osteoporosis case. I will recap it quickly. Okay, this is station blood result, yeah? Test result, scan result, any test result station. This is station. It is written clearly. It is written clearly what? DEXA scan shows. Okay, now, what history do you need in this case? What history do you need in this case? The question said she had a fall, wrist fracture, it was fixed, and DEXA scan was done, showed osteoporosis. So what history do you want? Guys, you need risk factor for osteoporosis. That's it. Dr. Mo, should we take all detailed history? No. Only risk factor. So how do I approach such a station? Simply. Such stations are 3 parts. Please, guys, write down. Any result station, 3 parts. The structure, 3 parts. History. Okay, any result station. Any result, wallahi important. Wallahi important. Any test result station. 3 parts. Okay, 3 parts. The first part, Dr. Sarah, is history. Okay. What is the second part? Explaining the result. Explaining the result is one part, one whole part. Yes. Why you do wrong? That you are stingy when it comes to explaining. You don't explain it explain it properly. What is the third part is management. Again, how many parts? If I have any case of a patient coming with test result, 3 parts: history. Second part is, third part is, we all stingy when it comes to explaining. Number 1 mistake. It is 1/3 of the mark. We are all long when it comes to history. A patient is tired. Blood result is done, showed iron deficiency anemia, and they tell you hemoglobin low, MCV low, and everybody they start asking obstructive sleep apnea, anemia, guys. The question said he came, and your colleague took history and suspected iron, and he did that. Today he's coming telling you the result. Tell me, you want to take another? Why? He's coming for the second visit. So your history in 1 word. Tell me 1 word. Risk factors. That's it. The question said osteoporosis or not? The question said osteoporosis. So your history, just that. Just what? That's it. Risk factors. The question said blood result, iron deficiency anemia. Your history is risk factors for iron. That's it. What is the second part? Explain that. Please, guys, explain it in details. Yes, we have done a scan called DEXA scan. This scan shows the thickening of your bones. The results come back and shows that unfortunately your bones are thin, which we call it osteoporosis, that lead to weakness of the bones. So when you have any fall, it's easily fractured. You see how I explain? Beautiful. That's 1/3. Explain the result. And finally is management. Is what? And when it comes to management, arms. That's it. Arms. What's arms? Advice is advice. R is risk factor. Which risk factors? The risk factor that she doesn't have or that she has? She has. Look, because I'm asking the risk factor. M is medication you're gonna give, and the investigation. M is what team you're gonna involve. S is safety netting. This is test result. So apply this on osteoporosis case. However, which one comes first? The history or explaining the result? Perfect. Well done. Whatever the patient wants. So my approach is, Alicia, Anthony, Julia, I have here, I can see from my notes that you are coming for the follow-up. Yes, doctor. I have the scan with me, the scan result. Would you like to have a chat first so we can explain the result in a better way? Or would you like me to explain the result first? If she said explain the result, so you will explain the result first, then risk factor, then management. Clear? You explain that. Don't say to her, but please right away, because you're going to explain it. So, this case, what are the risk factors for osteoporosis? I want to ask you here about risk factors. Yes? So, what are the risk factors for osteoporosis? And when I say risk factor, I mean in order. What do you mean in order? In order of our structure. You know our structure, P1, P2, P3, maftose. Be smart. Don't get lost. Are you going to ask all the structure or only the risk factor? So the risk factor. What is from P1? Fall. She had a fall. That's risk factor. Not for osteoporosis. She has fracture. Okay, now, what about the medical condition, P2? What is in P2 can cause osteoporosis, medical condition, and surgery? So surgery is, what is the surgery, the risk factor? Ovary removal, that's risk factor. What are the medical conditions that can cause osteoporosis? Malabsorption, for example. Malabsorption, one of the most common causes. Malabsorption, okay? The fact that she's menopausal is a risk factor, okay? The fact that she is in her menopause, risk factor. What is in medication? Because we have P1, P2, P3. What is in P3? Diet. What is in P3? Diet. Smoking. What is in maftose medication? Hormone replacement therapy, steroids, things like this. So my point is, even when you are thinking, Dr. Sarah, about the risk factors, think as per the structure. So is in this case, she removed her ovaries and it's menopausal. and diet. Diet. So clear, guys. So when you talk to her, always make her, she's got her own choice on explaining the result or telling history. And when you take history, signpost beautiful. Many factors can cause this condition. So it's already about a chat. So but look at the beauty of changing your phrases. So can you walk me through your lifestyle? I passed OET, but I'm trying my best to improve. Can you walk me through your lifestyle? How's the diet? Okay. Any health issues, which is medical condition. Any healthy issues that you see the GP regularly for? Change all because everyone will say any medical conditions. So any health issues that you see your GP regularly for? Well, doctor, I have this, I have that. Any surgeries in the past? Have had any surgeries? So risk factors. Then she will give you the risk factors. Then you explain the result. Then go to ARMS, advice and risk factor. ARMS, A and R. A for advice, R for risk factor. Would you advise about everything or about what she give you? What she gave. If she said to you diet, so always advise about diet. So what is the management for osteoporosis? Osteoporosis management. Tell me. As per ARMS, osteoporosis management. What advice can you give, for example, about diet and about calcium as dairy product? Advice as dairy product. Okay. Very important to make supposed to that. Sun. Okay. Again, prevent falls because fall with osteoporosis will lead to fracture. Okay. Medication. What medication can you give? Bisphosphonate. And she's very good. She was talking to me about that. Bisphosphonate. You take it upright and with plenty of water and stuff. What else can you give as supplement or medication? Medications, calcium, vitamin D, and who can you refer to? You can refer to what? Dietitian to advise about diet. Physiotherapy in order to give her an instruction about how to strengthen her bone and muscles, and always safety netting. Can she dance, belly dancing? Her partner will leave her if she doesn't dance for him. Yes, she can dance. It's fine. Yes, she can dance. It's fine. Dancing is okay. It's good. She should avoid the contact, exercise. So she can dance. It's by the way, the reason why I dropped it for the doctor, not to make a joke, because it is asked. Can I dance? But she doesn't say belly dancing. But I said belly dancing because I'm Julia from Egypt. So we have belly dancing in Egypt. So I said belly dancing. But she will ask you, can I dance? Yes, you can. Can I dance? Yes, you can. It's fine. Okay.
Dr. Mo?
Yes, doctor. Yes?
In the examination, you missed the BMI. In examination, it's
Sorry?
very important to know. In examination, you missed the BMI.
In examination, she should mention the BMI. Thank you very much.
Dr. Mo, I'm really sorry to interfere,
Sorry?
but do we need to examine in blood test and test result stations from the
If
first
it's the
place?
environment. Sorry? If it's in the eye, but for osteoporosis, not really. Yeah. No, for this case, no. Yes, doctor. Because
Do we need to examine?
the reason occupational
need to
therapist, if
examine
she's
in-
having a fall because of anything else, but here it's not. Here it's it's because the problem is the bone, not the. Yes, doctor.
Do we need to examine in test result stations anyway?
No, doctor. Test result stations, no examination, guys. Test result stations, no examination. Why? Because it's diagnosed. Okay, doctor, who asked this question?
Dr. Soki.
Allah, yeah, I free him. So, Dr. Sobki,
Yes.
this is station. This is Julia Robert Bones, yeah?
Mhm.
This is Julia Robert Bones, yeah? That's your bone. Okay? Let me touch your bone to see if it's soft or. Huh? No. Test result, the station is confirmed. The diagnosis is there. The scan is there. The scan said, DEXA scan said, what? It said osteoporosis. The scan said it's osteoporosis. What will the examination lead to you? You tell me. No, tell me. Maybe tell me. Nothing. Nothing. The examination will not lead to anything in these cases. But in the case of examination station, you will not examination. We spoke about it yesterday, yeah? It's examination. In PLAB 2, you're not going to bring, like a station that's examination and a long history. No. We need history taking, yeah, brother. Emergency, ABCD, yeah, brother. You understand? They're not gonna bring like a station where it's like this and you examine. No. And examination would not give you anything. It is
high
diagnosed
cholesterol station. Should
however,
examine the patient, the blood pressure.
Sorry?
If it is a cholesterol test result, shouldn't we examine the patient and check his blood pressure?
You can in this case, yes. A patient is coming and the cholesterol is high. And they told you my cholesterol was high, doctor, and the reason why I came because I had blood pressure. And I'm come for this result. Of course, you're gonna say we're gonna measure it because he's gonna be having a follow-up for blood pressure. But this case, no, I'm not gonna examine anything in osteoporosis. Okay? All right, guys?
Yes, doctor. Can we
Yes, doctor.
measure the height and weight just to get the BMI?
Sorry?
Can I measure the height and weight just to get the
Look,
BMI
guys,
of the patient?
Guys, in this case, I will advise her anyway about her diet. I'm talking about diet here. So, and exercise. And she should, I've just mentioned what is the management in this case. What did I say in management? Exercise, yeah, physiotherapy, diet. So even if she has high BMI, it's one of the factors that I'm addressing. You understand me, doctor?
Yes, doctor. Thank you.
Yeah.
Hello,
anyway,
doctor.
Next, guys.
Hello,
guys,
doctor.
I think you're not question. Guys, if I open the questions, we're not gonna finish. I can stay here 2 hours only osteoporosis, and then after 2 hours I will leave. Okay? No, seriously, I can stay for 2 hours, but I will leave. So if you ask more questions, it's not worth it. That's it. Okay, guys? I'm sure that some of them gets upset. They say we need to ask questions, but if I open it, with limits. If I open it for 2 hours, we might do osteoporosis and then go home. Haram, yeah. We need to do more stations. All right, guys? It's for your own good, wallahi. For your own good. Next station. كده هم يعني after I'll answer you 100% yes. Okay, 100%. So now I don't want to be racist against online doctors and they say you answer, Okay, next question. Next, it's just that, always I have in my schedule plenty of stuff, and with the questions I end up by saying nothing. So that's why I'm concerned. Next. Next, very important topic, test results. Okay, very important station, very common and very important station. You are an FY2 doctor? In the Wellman Clinic. Wellman Clinic is a clinic like GP, like people who go there. It's called Wellman. Am I well? Am I okay? Am I good health? General checkup. You are an FY doctor in the Wellman Clinic. Anthony Joshua presented 3 weeks back. Anthony Joshua presented 3 weeks back. For having a checkup, His blood pressure was found to be high. His blood pressure was found to be high, on the higher side. He was giving medication. Ramipril for his blood pressure. He is coming today because he is having some concerns. Very, very, very important stations. He's coming today because he's having what? Some concerns. Talk to him, address his concerns. Online doctors, I just want to pass a small message, yeah? I just want to pass a small message. The course without the online mocks is not complete. Do you understand me what I'm saying or not? The course, the recorded course without the online session is not complete. What do I mean by not complete? You must attend the sessions because I do things in the sessions that are not mentioned in the course. Why do you do so? In case someone have the online recorded course, يعني in Arabic we say يبله يشرب ميته. I don't know how to say يبله يشرب ميته. يعني يا دكتور أحمد. It's not gonna be beneficial. Okay? So I always add things in these sessions. Even for you guys, it might be new. Okay? You still? Okay. So let's start. Let's pick one doctor and all of you think, yeah, of the station. All right? And please don't think of the station of the script. I know the station. All of you now. I know the station. Maybe I'll change it. So, all right? Let's start. Dr. Dr. Iman Omar. Dr. Iman Omar. Dr. Iman. Let's start. Doctor is not here. Dr. Madiha. Dr. Madiha. Yes? Okay.
I'm in the group.
Huh? You are in October group?
Yeah.
Come, let's go station. One of the doctors is having her exam. She is in October group. So I want them to see our
Interaction.
yes, she is in October group and she is here in the academy. So I will just turn this, even though it will be the camera is not gonna be that, so they can see. Okay. So Mo Sobhi is coming today. He had blood pressure, was diagnosed. He's on medications, and today he's coming with a concern. Okay. Let's start. 8 minutes, guys. 8 minutes. Dr. Omar Sobki.
Yes,
8
I'm
minutes,
here.
and next station is yours because you are working so hard. Our DJ, we have to look after our DJ so he keeps going. So next station is yours. Get ready. Okay, doctor?
Okay.
Dr. Marwa from Tunisia. Dr. Marwa from Tunisia. She's in the academy and she was actually, she recognized Dr. Omar Sobki. She said that you practice together. Yes.
Ah, really?
Yes.
Okay.
Yes.
Okay.
Yeah,
Very
let's start. Listen, don't look after her with the time, yeah? 8 minutes.
Okay.
We don't want corruption. Okay, let's start.
Okay. Hello.
Hello, doctor.
Hello. I'm one of the junior doctors here.
Hello, doctor.
Hello. Hello.
Hello, doctor.
Can you just confirm your name and date of birth for me, please?
My name is Mo Sobhi and I'm 45 years old.
Okay, nice to meet you. I can see you're coughing. Are you all right?
Yeah, I'm just having some cough, doctor. Been there for about 5 days now.
I'm sorry about that.
Yeah.
Okay. And has it been bothering you?
It's bothering me. It's bothering me. It's even sometimes I can't sleep because of the cough. I cough in the middle of the night and I can't sleep because of the cough.
I'm sorry about that. And
Yes.
it's never happened before? This is new?
No, this is new to me, doctor. Yes.
Okay, no shortness of breath. No, is it dry or
Dry, yes.
No blood, no nothing.
Nothing, no.
Okay, and you're feeling all right otherwise?
Yes.
All right, we'll get back to this. I can see from my notes that you came in. We found that you had high blood pressure.
Yeah, that was 3 weeks back.
3 weeks ago.
Yeah, I just came for routine checkup and
Mhm.
I mean, I just like, you know, my girlfriend, she is very like obsessed about health.
Okay.
So she pushed me to come, even though there was no need for me to come. And then I told her, whenever you go to the doctor, I told her, whenever you go to the doctor, they are so complicated and they always like create things for you. And they told me that I have high blood pressure.
Yeah, I understand it wasn't good news
Yeah.
to you, but it's good that we found out that we can actually treat that.
Yes.
Yeah. So have you been taking your medication?
Yeah.
Yes?
Yeah.
Okay. So 3 weeks now taking your medication.
Yes.
Okay. And any problems, any concerns?
No,
No?
not really, no.
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 Okay, so you've been taking it all right. Have you been checking your blood pressure since
Yes,
then?
yes.
Yes. Okay. And did we give you any follow-up? Did we recommend any follow-ups, any bloods to be taken, anything like that?
Well, I mean, he did some blood investigations and
Mhm.
he said it could be the cholesterol and stuff, but yeah, he gave me a medication called Rami something.
Yes.
Ramipril. Yes, Ramipril. Yes.
And you have been taken.
Yes.
And when you measured your blood pressure, was it fine?
Perfect. My blood pressure is controlled,
Okay.
but my cough is a problem.
The cough is the problem. Yes, I can understand that. Okay. So apart from that, do you have any other medical conditions?
No, fit and well, totally fit and well.
Totally fit and well. No other medications, even over the counter.
No.
Okay. No past medical, no past surgeries.
No.
No. Okay. And so you told me that the cough was dry, no blood. You didn't notice any. You didn't lose any weight recently.
No.
Fever.
No.
Nothing else.
No.
Just this dry cough.
Yes.
Okay. So, Mr. Mo.
Yes.
Ideally, I would like to examine. Sorry, I didn't ask you. Do you smoke at all?
Well, I do smoke. Yes. Unfortunately, yes, and I can't stop smoking.
Okay. Do you have any allergies?
Do you wanna know what do I smoke? Or how much?
Yes.
You don't ask me. You want into allergy?
Yes.
Anyway,
Yeah. How much do you smoke?
I don't smoke cigarette.
What do you smoke?
I smoke shisha, double apple.
Shisha.
Yes.
Okay. And how much do you smoke?
I smoke 3 times a day. After breakfast and after my dinner, and then the night time once.
Okay. And for how long?
Not long, really. For about 15 years.
15 years.
Yeah.
Okay.
Yeah.
Okay. Thank you for answering my questions.
Thank you.
Okay. So Mo, I would like to examine you now.
Okay.
I would check your blood pressure. Okay. And listen to your chest.
All right. Okay.
Okay.
Blood pressure is within normal range and chest is free.
Okay. So Mo, from what you have been telling me, I'm glad you're taking your medication, and so you've been having this dry cough for 5 days now.
Yes.
I understand that I would say you smoke a lot.
Yeah.
It's on the higher side.
Yeah.
For 15 years.
Yes.
I understand that we can help you with that if you want, of course.
Yeah. Not now. I think not now.
Okay. But even though you're a smoker and you're coughing now, the first thing I would think about is actually the Ramipril now.
Okay. All right.
Because it's something new.
All right.
That you started 3 weeks ago, and this might be one of the side effects of the medication.
All right. Okay.
But because you are a smoker, to be on the safe side, I would discuss this with my senior, to make sure I'm not missing anything. But I would recommend that we do at least a chest X-ray.
I will end the station, guys. I will end the station, okay? We'll end the station, sorry. We ended it. We ended the station. Okay. Why did I end the station? Because, sorry? No, about she addressed everything. She is really, well, this station is known. A patient is coming. He was diagnosed the blood pressure. He was diagnosed blood pressure. 1 second. Yeah, a patient is coming. He was diagnosed the blood pressure, 3 weeks back. Okay. And he was started on medication, Ramipril. Today is coming with cough. Don't be scripted, because there is a mistake that people do here. Okay. One of the side effects of Ramipril is, but after excluding other causes. Clear? After excluding other causes. So it could be the medication, but it could be, please guys, because some people are so scripted to the level that they forget to exclude other causes. Online doctors, are you following me?
Yes, doctor.
Okay.
Yes, doctor.
So what do you mean by that?
doctor.
There is a topic in PLAB called medication side effect. What do you mean by medication side effect? It is a topic when everything is normal apart from that the patient is on medication. And always the symptoms start after the medication. So he will tell you, I have cough. When? 4 days back. Okay, started 4 days ago, and everything is negative. He's just hypertensive on Ramipril, and that's it. So it's called a medication side effect. It's a very important topic. But you must not be scripted to the level that, oh, this station is the medication side effect. Exclude everything else. So she, without realizing, have missed a very important 5 letters. A word of 5 letters. Fever. Fever. At least fever. At least fever. Do you agree?
Yes.
A patient is coming with cough. At least fever. That's it. Okay? This station, I have given her a clue. So normally, if you are suspecting it is the medication, guys, I'm here not to make you memorize things. I'm here to make you understand and open your mind and go for it. Yes, I give you the station that is a recall, but I make sure that I make you understand the topic, not just that's it. No. So if you are a doctor and a patient came and is complaining of cough, and you are suspecting what? Medication. But you must exclude other, at least the common causes. So first cause is fever. Any fever to exclude infection. She asked about sputum, any blood, is it dry, short of breath, but fever at least. Okay? So exclude other causes of cough. What are the most common causes of cough? Most common. Infection, so fever. Pneumonia, fever. Cancer?
Yes.
Weight loss. Okay? Contact. Have you been in contact with anyone who has same symptoms? What else?
TB, but it's been 5 days.
Yeah, I know, but I'm just saying in general now. So very important, the flows. Flows. Okay. I have excluded and everything is negative. Everything is negative. Okay. So because he's got high blood pressure, it's not my topic. His complaint is cough. But at least you need to measure the blood pressure in examination. At least, measure it. But I have given her, is smoking a risk factor for cough? Yes, I have given her coughing, and I've given her smoking for 15 years, 3 times a day shisha. What I liked about her attitude, about her performance, she did not go for the script. What do you mean? Usually scripted people will say, well, it's because of the medication side effect, and that's it. It's just the medication. You mentioned to me that you are in medication Ramipril. Okay, I will open the BNF, because any station you are suspecting a medication side effect, you must mention. I will open the BNF. Doctor, what is the BNF? Online doctors, they asking about the BNF. What is the BNF? Is there a better BNF than this? Because we've got plenty. It's so embarrassing to show them. Dr. Maha, what is a beautiful BNF? Good looking one. Please, anyone, children, BNF, adult, anything. So I should open my book, which is BNF, and I'll check for the medication. Clear, guys? And when you open the BNF, it will show the dry cough side effect. BNF, guys, yeah? BNF is in every single station in PLAB 2. Every cubicle in the exam, when you go to the exam, in every cubicle in the table, on the table, there is BNF. And only you guys will know how to mention BNF, because nobody else does. Nobody else does. How do you know that Ramipril can cause dry cough? Are you hero? Are you hero? Do you know? Do you memorize all the book? Do we? No. But either you are scripted, because amitriptyline causes closed angle glaucoma. Yeah, and everybody in the exam, as you mentioned to me, you are in amitriptyline. I suspect it can cause glaucoma. How do you know? Because I know this station. You understand me? So always mention that BNF to show them I don't know. It's very good to show, to act that you don't know. No, you don't know the station. No, you don't know the case. That's why people always say, Dr. Mo, the stations that are new, I pass them with high score. Why? No, because you don't know. You are thinking. With the Egyptian accent, you are thinking. When you are thinking, when you are thinking in front of the examiner, when you show the examiner how to think, okay, then wallahi, you get high score. You will float. When you show him how to think, you will float. You get high score. But the script, it's unavoidable. So please, in this case, always mention BNF, that you'll open the BNF. Okay?
We actually open
Even if you mention it, fair enough for me. Even if you mention it, that's fair enough. Okay?
Excuse me, doctor.
Yes. Yes?
Is it good for us to open BNF even for the well-known side effects like
No. I'm not talking about well-known. I'm not talking about like iron deficiency anemia. I'm giving him iron. Everybody knows constipation, yeah, black stool. But I'm talking about amitriptyline causes glaucoma. I wouldn't know as a you know, unless you are a specialist. But as an FY2 Mickey Mouse, poor doctor, just started working 5 minutes back. You start working 6 in the morning. You know, you've never been working as a doctor and you just started. You wouldn't know amitriptyline causes glaucoma. Do you agree with me? That's why I'm saying always mention the BNF. But not with the common things. Not like with steroids. No. Steroids, we know. But amitriptyline, some medications, yes. All right, doctor? Anyway, so what is the structure for this station? The structure for this station, please, it is a medication side effect. How can I help you? Doctor, I am having a cough. So what is the presenting complaint? Cough. Go for it. Can you please tell me more about it? Doctor, the cough started that day. Is it dry? Is it wet? Okay, any sputum, anything, any blood, as she asked, any fever, and then everything is negative. Everything is negative. I can see from my note that you have been diagnosed with high blood pressure. Guys, whenever it's written in the question something, use it, please. Use it early as you can. Yes, doctor. She missed something. I told you in the last station, deal with the patient as a whole. She did not say to me any dizziness, any headaches, any blurred vision, any chest pain as a complication of. Even though I'm coming with cough, it's fine. I am coming because of, but I have been newly diagnosed with. So 2-3 questions كده ناكل عيش يعني. 2-3 questions. I can see that I've been diagnosed with high blood pressure, any symptoms at all, any headaches, blurred vision, chest pain, things like this, you know. Okay, now, no doctor. What medication are you using? Ramipril. Okay, you always must relate the symptom with the medication. So do you mean that the cough started after? Yes, and I need the examiner to hear. I need the examiner to that you are relating the symptom with. Because if you don't ask about the symptom, is it before or after the medication? Doesn't look good. Yes, doesn't look good. Imagine if you give him the medication as a cause, but you never ask. Has the cough started? If you don't mind me asking, has the cough started before or after? Yeah, after, doctor, after using the medication. A week later, 2 weeks later. Now you're smart. You know, you are thinking, okay, of the medications of the effect. Then in the examination, what you must verbalize as examination? You must verbalize examining 2 things: checking the blood pressure because he's got new blood pressure, and the examining the chest. Then go to management in provisional diagnosis. What is the suspicion here? Guys, if I did not give her the shisha for 15 years, 3 times, she could have just go for the medication side effect. Online doctors, are you following me?
Yes, doctor.
Yes.
Are you benefiting anything?
What is shishi?
Sorry?
What is shishi?
Shishi. What is shishi? Shishi, brother, it's an Egyptian traditional smoking. They call it hookah, or they call it pipes, or they call it, you know, what did they call it else? Shisha, brother. I will bring a picture the next time, okay? Or I can bring the shisha next time. Bring the whole shisha and you can do, you know, you can counsel me. Anyway, so yes, it's something that people smoke and it's worse than cigarette in terms of effects, but it's very tasty. Anyway, I'm only joking. Yeah. Anyway, so if I did not give her smoking like this, she could have gone for. But I loved the way she. Hang on a minute. Yes, he's coughing. Yes, there is nothing but medication side effect, but he's smoking a lot. So she said, because you are smoking a lot, I will check with my senior. We're gonna do scan in the chest. I loved it. I said, that's the way I want you guys to be. Yes, I can bring you a station exactly in the script, but I add one word. I add, think about it, analyze it. Is it only medication side effect? Could it be the shisha? Yes. Do you agree with me? So that's why I want you to be alert all the time. Okay? And now you need to review that because it's the cause. So we'll review the medication. What else can you give this patient? Yeah, what else? If the AC inhibitors, you can give him angiotensin receptor blocker, which is Losartan. Okay? Losartan, Ahmad Sartan, Ali Sartan, you know this group? Anything with Sartan, yeah?
Dr. Mo?
That's it. Yes?
Sir, can you please tell how can we mention the BNF thing? Like what we will say to the patient, that we will check in the BNF for the side effect,
well,
or
I'll check. I'll where are you going? You're gonna be around. Perfect. You're gonna say, I will check the book, the medication book, to check for this kind of medication because I'm suspecting it could be the cause, the reason why it's causing this symptom.
Okay, sir. Thank you.
Perfect. Okay, guys, that's a medication side effect station. That's what a medication side effect station. Clear? Next station.
Hello, Dr. Ahmed. Dr. Mo.
Yes.
Yeah, I just want to ask for this case now, how are you going to manage it?
Sorry?
Because for this case, you don't know if it is due to the medication or due to probably bronchos or so. Maybe
that's what we said, doctor. That's what we said. That's why we said it could be the medication or it could be.
Yes, the smoking effect.
Yeah, it could be cancer. You never know.
Cancer, yes.
But even if you're suspecting cancer, chest X-ray will show.
Okay, all right. We just follow
initial. Sorry?
That means the management will be basically on the investigations that we are going to do. We are going to talk more
investigation, on routine blood investigation, routine blood, chest X-ray, and that's it.
Okay. All right.
However, if everything is negative, apart from the medication, no need for investigations.
Dr. Mo, I need to ask you one thing. Are we able to give him the alternative medication, or we need to refer him to some specialist to?
No, doctor, you are able to give him alternative medication. Doctors, okay. GPs in a GP clinic here, guys, you manage blood pressure, you manage diabetes, you manage only if it's not responding to treatment or something, you refer. No, you will change the medication, doctor.
Can we add one more thing when you mentioned that it was disturbing your sleep? So can we explore it more?
Perfect. Disturbing my sleep. I said disturbing my sleep. When I give it, I want to explore it. Yeah, disturbing the sleep. I said to you, it wakes me up in the night. No? Yeah. Yes.
Sir, you said that we will change the medication, but do we tell the medication class, or we just say that we will change our medication with help of senior,
no,
or we will just say that we will change?
You don't need to mention any name.
Okay, just say we will change the medication with the help of a senior. Can we say that, or we just have to tell ourselves?
No, I mean you don't have to mention. Doctor, can you talk? Doctor, can you talk about the prices? Mute the mic, please. This doctor is talking about the prices. Doctor, I hate when people open the mic and I don't have the option here to switch. I hate it. Seriously, very irresponsible. Doctor, can you switch off the mic if you don't mind? Anyway, so you don't need to mention medication, guys. Yeah, you don't need to. I will review the medication. Talk to my senior. You need to review the medication. Yeah. Okay.
Doctor, I have a question. Can you ask symptoms for COVID? Loss of smell, loss of taste.
Well done. You can. She's saying, can we ask about COVID? Yes. Why not? The whole world is stopped because of COVID now. Yeah. Yes. You can even say COVID swab. It's fine. Next station.
Can you change the medication in GP?
Yes, you can change the medication in GPS. Except for antidepressant. Antidepressant, no. Psychiatrist. But high blood pressure, low blood pressure, review medication, diabetes, yes, you can.
But we don't need to refer to cardiology.
No. You don't need to refer to cardiology for blood pressure medication review. No. You refer only to cardiology if the blood pressure is on, even though the patient is using, and you tried everything is not controlled. Refer to cardiology. Imagine if a GP cannot review medication. What is the job of a GP then? That GP is a big thing. I mean, it's something, you know, not just what do you want, cardiologist. What about you? I need diabetic. What about you? No, the GP works. He does things.
The backbone of the NHS in UK is a GP. Yeah?
Sorry?
I said the GP is the backbone of the NHS in UK.
That's it. The GP is the backbone of the NHS. So if the GP has, like, if the GP is the backbone, what's your name, doctor?
Nazik.
Dr. Nazik. GP is the backbone of the NHS. So if anything happened to the GP, what's going to happen to the NHS? Kuda Equine. Next station. Yeah. Okay, guys, write down the station. 55 years old. 55 years old. 55 years old. Rayana, you know Rayana? 55 years old, Rayana. Rayana. 55 years old, Rayana. She had cellulitis a month back. She had what? Cellulitis a month back. By the way, online doctors, every single scenario I am giving you is not made in my brain, and no. It's a lab scenario. Are you following me? It's a lab scenario. So anything I do in the mock and it's not in the recorded course, that's what I do. I do things in the online course, things in the course, things in the topic up with the mock. Clear? Because doctors who are missing these sessions are missing a lot. Seriously. So 55 years old Rayana had cellulitis a month back. All right. She was treated for cellulitis. During her admission, she was found to have high blood pressure. During her admission, by the way, Dr. Sarah, I did not recognize you when you came. Yes. During her admission, she was discovered to have high blood pressure. Okay. For that, a medication was given. For that what? A medication was given. Amlodipine. Amlodipine was given. The patient is coming for follow-up and she has some concerns. Talk to her, address her concerns.
Okay.
Let's start there, brother.
Okay.
Yes. Very important.
Okay, I'm ready.
I'm
sorry.
ready.
We are in a GP setting?
Yes.
Okay. Okay. Hello, my name is Dr. El-Sobki. I'm one of the junior doctors in ZGP clinic today. Can I confirm your name and date of birth, please?
My name is Rayana. I'm 55 years old.
All right. And how would you like to be called today?
Ryan.
All right, Ryan. So I can see from my notes that you had cellulitis a month back, and then you discovered in the hospital that you have high blood pressure and you take some drugs for it. Am I correct?
Yes.
Okay. So what brought you to us today?
Well, doctor, I'm just, having some swellings in my leg, and it's really bothering me because I don't look sexy anymore. My legs
I'm
not
really sorry.
good. When I wear my skirts, I don't look good enough. I'm embarrassed to wear my skirts.
All right. I'm really sorry that you feel this way, but we are here to help you and we will address that concern shortly. And can I know when exactly did this problem start to happen?
Well, it started like 10 days back.
Okay. And can you tell me more about that swelling other than when did it start?
Yeah, it's like, swelling in my both ankles.
Okay. And that swelling, did it start abruptly or gradually?
Gradually, doctor.
All right. And since it started till now, is it getting better or worse?
Well, it's like not it's increasing, but not that quick. But it is not the same as like before.
Okay, that's good to hear. And is there anything in particular that makes that swelling better or worse?
I don't know.
All right. So, Rayana, apart from the swelling, do you have any other complaints?
Well, nothing really.
Okay. And that swelling that you mentioned right now, did it appear after you started taking the drugs or before it?
I don't take drugs.
I mean the drug for your blood pressure.
Ah, the medication you mean? Okay.
Yes.
Well, it's after the medication, yeah.
Okay. Okay. So I would like just to ask you some questions so can I have a bigger picture of what's happening? Would that be all right?
Okay.
Okay. So do you have any medical conditions that's worth of mentioning to me? For
Well,
instance,
just
like liver problems or heart problems?
No, blood pressure only.
Okay. And there's nothing wrong with your kidneys?
My kidneys are beautiful, no problem.
Okay. Okay. So I do understand that you took the drug for your blood pressure, and I do understand your concern. I do, yes. I mean the medication for blood pressure, and I do understand your concern for the swelling that you have and how it affects your look. But apart from this, do you have any other concerns?
No.
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 Okay. So. Okay. Are you allergic to any type of medicine?
No.
Okay. And I can see also that you have cellulitis. Can I understand can you tell me more how that happened?
Well, I just, I had cellulitis and, my leg was inflamed and just like, red and hot. And I mean, I got given antibiotics and it was fine after.
Okay. And how long did you stay in the hospital for this?
Well, 4 days. I was on antibiotics. Yeah, 4 days.
Okay. I would like just to examine you. Would that be all right?
Yeah.
Okay. I will just examine your observations and your general physique, and I will examine the swelling that you have.
My general physique are okay, beautiful, sexy, and just bilateral ankle swelling.
Okay. And do you have any idea what might be causing this problem?
I don't know.
Okay. So, Rayana, from what you have told me and from the history that you have told me, the swelling that you have is actually can be caused by the drug that you are taking for your blood pressure. For the medication that you are taking for your blood pressure. It's a very known side effect.
Yes, okay.
It's a very known side effect for the for that type of medication precisely. Do you understand me?
Yes, doctor. Yes.
Okay, and do you have any other expectations from us today?
No, just I wanted X-ray on my leg, doctor.
All right, that's a valid concern. Okay, but I would like to talk to you a little bit about the management plan that both of us can agree upon. Does that sound all right?
No, I want an X-ray.
Okay. I will consult with my senior for the possibility of an X-ray and to see if it's essential or not. But I would like just to talk to you a little bit.
I want an X-ray. I want an X-ray.
Can I know why you want an X-ray?
Because I hurt my leg. I had trauma to my leg, and I'm suspecting it could be fracture. I don't know.
Okay. So we will arrange an X-ray for you if that's okay, because that's a very valid reason to do an X-ray.
Okay.
Does that sound okay?
Yes.
Okay. So first of all, I will just consult with my senior and talk to my senior about this consultation, so to make sure that I didn't miss anything at all. Does that sound all right?
Great.
Okay. And we may need to prescribe some drugs for you to help with the swelling.
Would you like to know more
about them? There are some medications I would like to prescribe some medications to help you with the swelling. Would that be all right?
Okay.
Okay, so we will give you some certain type of drugs which we call diuretics that can decrease the swelling a little bit of your ankles.
I don't take drugs.
For the medication. Okay.
Okay, medication.
Okay, and I will do some investigations just to exclude any other cause of swelling. Does that sound okay with you?
Yes, doctor.
So
yes.
I will just do some investigation to assess the function of your kidneys and your liver, and I will also do some routine blood tests. Does that sound all right?
It sounds perfect.
Okay, and also we will do the chest X-ray because you mentioned that you had a trauma in your leg. Okay.
Okay.
Okay, and we may need to refer you to an orthopedic in case that in case the X-ray revealed any type of fracture of any sort.
Okay.
Okay, and I will just look. I will just review the medications. Okay, that you are taking, and I will also consult with my senior that we may need to change that medication to other type of medication, so we can avoid that problem if the medication is the cause. Does that sound okay?
It sounds perfect.
Okay, and please, Rayana, if you felt at any point that you had jaundice or you had abdominal pain, okay, don't hesitate to come back to us.
What is jaundice, doctor? What is that to do with the?
I'm sorry. Jaundice, if you felt that the color of the skin had a yellowish tinge.
Okay. Why, doctor, you just saying jaundice?
It's because sometimes when the liver is affected, it can cause a similar problem, which can cause swellings in your body, in your lower limbs.
Okay.
Okay. So does that sound okay?
Sound perfect.
Okay. So is there any other concern you would like to talk to me about?
No, doctor. No.
Okay.
Guys, did you see? Under pressure. Why do I always say be simple, Bluetooth being simple? I don't like myself. When I teach any lecture, I like to be simple and not sophisticated, guys. Why? You see, Dr. Omar, I'm sure he knows the word why. But I need X-ray. I need X-ray. And he said why after we already said, come on, guys. Come on, say why. But under pressure, you get stressed out, and this happened. But even though if he was observing, he would say, why? If he was observing, if he was on the other side, he would say like all of you, why? Everybody on the chat box, why? Ask why, and he's not asking. Ask why, But anybody is doing the station, it is, tough.
Literally, Dr. My mind blanked. You are very intimidating. Like I was getting ready and I was like, okay, I will ace it. But as soon as you talked, I got blanked straight away. Like I was literally shaking.
No, no.
Me too.
Ours, okay.
I forgot everything when I was talking. I forgot the structure.
But good job that you get under this pressure.
It's also in the exam we will do.
Yeah, good job that you get under pressure. And even Dr. Omar, I can tell he's practicing well. I can tell he's doing really good job. I can see he's doing a very good job. But still, he's doing a very good job. Seriously, I love his station. It was nice. Okay, as good as the other doctor as well that we did also as well. But again, sometimes yes, I mean little things. So please be simple. Practice a lot. You know, practice a lot. Without practicing this exam stuff, with practicing it is easy. You know. So I kept saying to him, drugs, medication, please. Drugs, medication, please. Drugs, medication, please. Drugs, medication, please. So whoever he practiced with, whenever he say drugs, say to him, I don't take drugs. Yeah. Anyway, but one of the doctors said, I mean, when he was talking, what is my complaint? Swelling ankle. Swelling ankle, okay? Okay. Which ankle? Dr. Omar, which ankle?
I didn't ask. I
said my ankle. I said my ankle. I did not say both of my ankles. I did not mention it. Which ankle? What about which ankle? I mean, am I walking on my ankle or not? Am I walking or I'm not walking? Is it painful? Guys, think superficial. Forget about the station. Forget about the station. Someone is coming to you saying, my ankle, I've got ankle problem, it's swollen, doctor. Dr. Omar, forget about the station. We know we're going to end up by saying side effect, medication side effect. We all amlodipine, calcium channel blocker causes bilateral ankle swelling. We know that. Put it aside now. Just be yourself. Doctor, I have swollen ankle. Which one? Is it left? Is it right? Is it both? Are you able to walk? Is it preventing you from walking? So any pair compare and ask about the function. Clear? Clear, Dr. Omar?
Yes.
What is the first differential for this case? Ankle swelling.
Trauma.
Did you hurt your leg? Did you hurt your ankle? Even if I am saying bilateral. Dr. Mo, PLAF2, we need, I'm sorry to say it, we need steroid doctor. We need someone who's more safe than smart. What do you mean? Any patient with chest pain on that side. First differential? MI. Dr. Mo, but you know, he's not having shortness of breath, I don't care. MI. MI, ECG. So we need a doctor who's more safe than sorry. More safe than sorry. We need a doctor who's safe. Doctor, he told you bilateral, I don't care, trauma. So what is my first differential? Did you hurt your ankle by any chance? But if I ask Dr. Omar in the street, if I meet him in the street, doctor, how are you, doctor? You know, just I've got ankle problem. Did you have a fall? Did you hurt yourself? Normally. But in the station, no, this is the medication side effect. This is the amlodipine station. No, it's not amlodipine station. Even if it is, number one differential is did you hurt your ankle? What is the second differential, Dr. Omar?
The drug itself, the side effect from the drug.
Drug again.
Sorry, the medication.
Yeah. Drug again, Dr. Omar. The drug. What is the second differential?
Yeah, so the differential can be trauma, the
what
medication.
Arthritis. Arthritis.
No.
Very good.
No.
Doctor, what do we ask?
Perfect, Dr. Rami Fadl. Perfect. Well done. Dr. Rami Fadl. Cellulitis. She had cellulitis a month back. Yeah? And she's coming with a swelling. I have not seen the swelling yet. She's saying swelling. Could it be that cellulitis is back? Why not? Yes. Do you agree? Think superficial. The question said past the history of a month back. And she's coming with, and I said to him, cellulitis in my leg. Could it be cellulitis? So one question to ask. Any fever? صح يا دكتور عمر؟ Am I wrong or right?
صح مظبوط.
Be superficial. Be Mickey Mouse doctor. Superficial. Think superficial.
Can I ask a question, doctor?
Yes.
But if she has cellulitis, wouldn't her complaint change? Like her complaint was about her leg being not as beautiful as before. So
Dr. Dalia, PLAF2, is about being safe, and that's it. There is a swelling. There is a swelling. Guys, seriously, PLAP 2, safe. Like, I even get used to this habit from being in UK here. If you go to the patient, wallah, you go to the patient, doctor, I have heartburn, you know. I have heartburn and I've been taking omeprazole for some time and I've got this, you know, chest discomfort. What am I talking about now?
Classic.
Classic what? What is this? Classic what?
Nine.
Huh? No, I'm
Angina.
using omeprazole and I'm having heartburn.
Yes, but I have to do MI as well.
If you don't do ECG, you will be bullied in the hospital. Really? Yes, you will be bullied. Brother, she's saying omeprazole and heartburn and ECG. يا عم ECG. طه. Seriously. So my point is, I don't care. That's how we do PLAP. Passing PLAP 2 is one thing, and being a good doctor, we just need to pass PLAP 2. I'm here to teach you how to pass PLAP 2. Any patient is coming with chest pain on the left side. Doctor, I was playing squash. ECG. Brother, I was playing squash and I've never played squash. ECG. Brother, squash must ECG. Okay? Guys, that's the principle of PLAP 2. Anyway, so let's not take so much time. So first, differential trauma. Did you hurt yourself? Any fever by any chance? And then Dr. Omar said the rest. He mentioned about kidney, any kidney problem. He mentioned about heart failure, any heart problem. I said no, no, no. You understand? And it's fine. Now, the only positive finding here is amlodipine. But, I'm sorry to be annoying, but this patient was discovered blood pressure when? When, Dr. Omar?
During his stay in the hospital.
And she's coming today for the ankle swelling. It's fine. But two questions. Dr. Omar. Two questions. How is the blood pressure? Did you measure? Is it controlled? Any headache, any blurred vision, any chest pain? No, that's it. 2 seconds. So I have here, how is the cellulitis in your leg? Is it okay now? So I have here three big words. Cellulitis, high blood pressure, ankle edema. Cellulitis, how is it now? Do you think that this swelling is has the same or has similar, okay, description of what happened a month back? I hope question. Cellulitis is out. No, doctor, it's not the same. And you said that you've been diagnosed with blood pressure. How is it? Is it controlled? Do you feel any headaches or any blurred vision? Blood pressure is out. Then start with ankle edema. Do you understand? Dr. Omar, do you understand?
Yes, I do.
So the patient is written cellulitis, blood pressure, ankle edema. Ankle edema is the recent presentation, but cellulitis and blood pressure before. Blood pressure easy, 2 seconds. I can see you've been diagnosed with blood pressure. How is it now controlled? Any headaches, blurred vision? No, doctor. And what about the cellulitis that you had? Doctor, it was clear. Do you think this ankle edema, this ankle problem is similar to what happened before? No, doctor. Coming back to the ankle edema. Which ankle? What about the other ankle? Are you able to walk? Did you hurt yourself? Any heart problem, kidney problem? Move on. And the session is finished. Go to examination. Examine. I will look at the. Do you need to look at the ankle? Yes. You need to examine the ankle, and then you need to measure blood pressure. Yes. So measure blood pressure, examine the ankle, and in management, the only positive finding is amlodipine. Review medication. It is the side effect of the medication, and safety net the patient even after reviewing the medication. If it's increasing, if it's getting worse, come back. Next station. Next station. Next and last station. Dr. Shafia. Dr. Shafia.
Hello.
Hi, how are you?
I'm good, thank you. How are you?
Good.
Sir?
I'm fine. As long as you are fine, I am fine.
I'm good, thank you.
Okay. Do you want to write down the question?
Yes, sir.
Where are you from?
I'm from Pakistan.
Pakistan. Yes. Do you see my Pakistani new outfit? Nice,
You're
huh?
wearing
It's
Ajrak,
keeping me
yeah.
warm.
It's from Sindh.
Ajrakia. Beautiful Ajrakia. I love it. I love it. It's keeping me warm in this weather. It is actually, you know, makes you warm. It's very nice.
Sir,
Okay.
first, before starting the station, I just want to say that I have practiced 2 times before. So I feel like my other colleagues should get the chance because they are waiting, and I just want them to be practice as well, because many people, they wait to practice with you, and I'm getting this chance for 3rd time. I'm very lucky. I'm not, with due respect, I'm saying this.
Oh my God. 3rd time?
Like her name.
Yes.
I imagine you saying her name from the other session.
It is, the problem is, I do sessions here, sessions in the academy, clinical sessions, and it just like you get your 3rd time. MashaAllah, 3rd time. 3rd time.
Yes.
Okay. Allah, she's very nice. She said you choose someone else. Perfect. She did 2 stations and this is the 3rd time.
Yes.
Perfect. Wallahi. Wallahi, perfect. Perfect, Doctor. Wallahi, بجد يعني 3rd time. And wallahi, Doctor. Dr. Kudali Brianka.
Hello.
Hello, doctor. How are you? Hello? He's not listening. Dr. Juwaireya. Very nice name, Juwaireya. Huh? Juwaireya. Dr. Juwaireya. Okay, Dr. Luai. Dr. Luai. Dr. Luai.
Hello, Dr. Mo. Can I do the station? Dr. Loa is not here.
Or maybe if he's not Egyptian, he might not know the song. Really? Dr. Luai. Can you hear me? No, I think he's not around. Okay. Will you choose one else? Another doctor. Whenever I choose someone, they go offline.
Every time I say a finding, he changes the station.
Was it you? Insomnia? Was it insomnia or what case was it? Doctor.
Headache, and he changes the station every time I find the finding. Every time.
Dr. Shaira. Dr. Shaira.
No. I had it.
Whenever I choose someone, they go offline. Dr. Shaira.
Hello, doctor. How are you?
How are you, Dr. Shaira? Okay?
Yes, I'm fine. Thank you.
Where are you from?
I'm from Bangladesh.
Rapport. We need to build rapport. Nice to meet you, doctor.
Nice to meet you as well.
Let's have a beautiful station and you'll do good.
Doctor, I have not finished all the topics yet.
Have you done pediatric? Guys, pediatric is a must in the exam. You cannot have left to do pediatric. There are topics, pediatric gynecology. So pediatric, a branch, small branch, 1 station. So have you prepared pediatric?
Yes, I studied just 1 time.
No problem. Be yourself. Just be yourself. Write down the question and be yourself. This is the last station. Let's do it. Pediatric, because I want to give you a message about pediatric, guys. You take long history. A child is coming autistic, and you keep taking all the history in the world. Why? Autistic is developmental problem. Ask only about development, and then How's the child otherwise? Everything all right? Any concerns? Is he well? Is he, you understand? No head to toe in a developmental problem. That's what people, development, head to toe. Development, focus on development. And then quick general, questions about, is he otherwise, is he well? Any other concerns? Does he have any illness? Is he any fever? That's it. Not development, and you are asking head to toe, any head injury, any discharge from the nose, Anyway, doctor, let's start. Write down the
Doctor,
question.
I read the topic 1 month ago, and it might be a disaster.
Another one, okay.
In front of everyone.
Don't worry. We'll choose another one. Dr. AAMIR Amir Khan. We need to pick one doctor to finish the session and go home. Huh? See? Yes, come. Okay, guys. Online doctors, they don't love me. They hate me.
I try, doctor? Dr. Mo, can I try?
Doctors, pick one of the doctors here. Okay, online doctors, they hate me. Too late بقى خلاص, too late. I'm trying to choose for about 10 minutes. 10 minutes, guys. You don't like me anymore. Dr. Amr is saying I'm intimidating, huh? You as well? Oh my God. Dr. Amuna hates me as well. هو
लैपटॉप को बैटरी को
Yeah. 6 weeks old. 6 weeks old. 6 weeks old Mo Khan was brought by Mo Khan بقى دلوقتي Mo Khan. 6 weeks old Alex was brought by his dad Mo Khan. Mo Khan, okay? Was brought by his dad Mo Khan because he's been vomiting. How old?
6 weeks.
6 weeks. Brought by his dad Mo Khan. And the boy is Alex Khan. So Alex Khan is the boy, Mo Khan is the father. يعني. Okay, pediatric hospital, pediatric A&E. Okay, so was brought by his dad Mo Khan because he is vomiting. 6 weeks, neonate baby.
Hello.
This is voice بقى. She's very confident and her voice is not coming like hello. Yeah.
Hello, I'm Dr. Sarah Sultan. I'm one of the junior doctors here.
Hello, doctor.
May I confirm your name?
Well, my name is Mo Khan.
Okay, and may I confirm your child's name and date of birth, please?
Alex Khan, and he's 6 weeks old.
Okay, and what brought you to the hospital?
Well, he's vomiting, doctor. He's been vomiting like since yesterday.
Okay.
Vomiting, and just like concerning anything his mom gives him, he's just vomiting.
Okay.
So his mom rang me.
Okay.
And she said to me, come and take your son, to the doctor because she's quite busy with her boyfriend.
Okay.
And I brought him. I had to be honest, I was busy as well, but I had to come. So yeah.
So this must be so distressing for you and his mother as well.
But is it gonna be long consultation because I've got a date?
I don't think it's gonna be a long consultation,
Okay.
but I'm just gonna ask you a couple of questions.
It's fine. So just because I've got a date, I'm dating a new girlfriend, and I just want to know quickly what's happening, so I take him and go here. So okay. Yeah.
So Mr. Mo, have you witnessed the child vomiting?
When I picked him, he was vomiting. Yeah.
Okay. Do you know how many times did he vomit?
Well, whenever his mom gives him anything, he vomits.
Okay.
Yeah.
And have you noticed the color of the vomit?
It's just the milk. Anything.
It's just the milk.
Yes.
When you did like that, is it a projectile vomiting?
It goes far away.
It's a
Yes.
projectile.
Yes.
Okay, it goes far away. Okay, and have you noticed anything else in your child?
No, just just the vomiting. He doesn't really live with me. He lives with his mom. So she's just and that's what she said, and I've seen him just vomiting, and that's it.
Okay, and have you noticed that he has fever?
No fever, no. How long do you think roughly the consultation will take?
Roughly
Roughly?
it will take 10 minutes.
All right, okay. Okay.
But I'm not sure about your child's condition, so
Okay, can we make it shorter than this? Like,
I'm not sure, but we might need to keep him if he's not feeling
all
well.
right, okay, it's
Is
fine.
that all right?
Yeah, you can keep him, it's fine, yeah.
Okay. Okay.
Yeah, so he's vomiting and he's
Okay.
drinking all the milk that his mom
Okay.
gives him.
Okay.
Yeah, all the time, yeah.
Okay. And have you noticed that he has dry mouth?
Not really, no.
Is he crying so hard?
His mom didn't tell me
Okay.
the idea about this, no. I've not seen, I just picked him, but
Okay.
he's vomiting, projectile vomiting, goes far away. Every time she gives him his milk, he vomits.
Okay. And you don't change nappies, I understand from what
Well,
you're saying.
I don't change nappies, no. I mean, this is the first time to see him, so
Okay.
yeah, I don't change his nappies. But she said, yeah, she mentioned that
Okay.
he's not wetting nappies as often.
As often, okay.
And she mentioned that he's lethargic and he's like sleepy, sleeps a lot since yesterday.
Okay. So, and you said that she've noticed that he is lethargic and he's not changing nappies as
Yes.
much as he used to do.
Yes.
Okay. And you mentioned about that the color of the vomit is milk mainly.
Same, yeah. What is given to him, he vomits. Yeah.
Okay. And you said that he doesn't have fever.
No fever, nothing else at all. No diarrhea, no fever, nothing else.
Do you know what his mother is feeding him?
He's feeding him
She's
milk.
breastfeeding him?
Yeah, no, breastfeeding, and she's giving him formula as well, both.
Okay.
Yeah.
Okay. So you haven't noticed anything else?
Nothing else, just vomiting.
Okay. And
Projectile vomiting, no fever, no rash, nothing.
Okay. And do you know anything? How was his birth?
Well, I mean, perfect. There was no issues. I mean, full term.
Full term.
Yeah.
He didn't stay at the hospital.
No.
Okay. Do you know if he is up to date with his job?
Perfect.
Are you
Yes.
sure?
Yes, 100%
Okay.
positive.
And are you satisfied with his Red Bull?
Yes. No issues, no problem.
Okay. So what about his development? You seem that you don't
It's 6
feed him-
weeks. Yeah, it's 6 weeks. So.
Okay.
Mm.
So
Perfect.
so you said that his mother is he's living with his mother.
Yes.
not living
Yeah,
with
with his
okay.
mom. Yeah.
Okay. And do you know who spends most of the time with him?
His mom and her
Okay.
boyfriend.
Okay. And do you know if his mother is working or not?
No, staying at home.
She's staying at home with him most of the time.
Yeah.
Okay. So Mr. Mo, I would like to examine your child. Is that okay?
Okay.
So I will do. I'll check his vitals. I'll check his abdomen to do abdominal examination on him. Is that all right?
Olive-shaped mass and dehydration. Signs of dehydration.
Signs of dehydration. So, Mr. Mo, after I did my examination on your child, I have noticed that there is a mass in his abdomen, which could be a sign of something we call pyloric stenosis. Do you know
Pyloric
what this is?
stenosis. No.
Okay, and Mr. Mo, what's your main concern here?
Vomiting. We want to stop the vomiting. That's our main concern. We just need him not to vomit, because him vomiting, his mom is blah blah blah, begging me, and just like I had to bring him, and you understand, just want something to stop the vomiting.
Okay, and what are you expecting from us today?
Just anything to stop the vomiting. Just make him not vomit, so I take him to his mom. Yeah.
Okay, so Mr. Mo, we will try to make him stop vomiting, but the main thing is that we need to. I'll speak with my senior, and firstly we need to make sure that he's not dehydrated.
Yeah, he is dehydrated in
He's
examination.
dehydrated. Yes, he's dehydrated. So we'll give him some fluids to make sure that he's not hydrated, and we're gonna admit your child here.
Okay.
Because we need to do a surgery.
Or surgery? Why?
For the pyloric stenosis.
Perfect.
Yeah.
Okay, I'm the father. She's like, I'm the examiner. I'm the father.
Yeah.
Surgery?
Yes, we need to do a surgery. So I know that you're busy and you just mentioned that around our consultation, but we need to keep your child here.
Okay.
And we need to do that surgery for him.
Okay.
Okay.
Fine.
So is that all right with you?
Perfect.
Okay.
Yes.
So Mr. Mu, as I mentioned to him, we'll give him fluids, we'll give him to make sure that he's not dehydrated. I'll inform my consultant. We'll run further tests on him. We'll do scans to his abdomen to make sure that the diagnosis is correct and everything is all right. And so do you have any questions?
No.
Okay. So Mr. Mu, at the moment, you're just gonna stay at the hospital for a while. Is that okay?
He's gonna stay in the hospital for a while.
Yes.
Okay, it's fine.
Okay, so you might not attend. You might not be able to reach to to go to your date. Okay.
No, it's fine. I will leave him and
Okay.
I will go to the date. And even his mom, like she's fucking busy with her boyfriend, the new boyfriend.
Okay.
So we'll see. I'll ring her. I'll say she has to come because she said that I'm busy as well with the boyfriend. But we're gonna see. I'm gonna keep him and we're gonna see.
You're gonna leave him in the hospital.
Yeah, it's fine. To be
Okay.
admitted, yeah.
So I just need you to tell his mother what's happening.
I will tell her,
and-
definitely.
Yeah.
Definitely,
Okay.
yeah.
So Mr. Mu, in case of both of you are so busy, we can involve social services
Perfect.
in that situation.
ايوه كده.
She was like, busy. Yeah, I've got a date. What about his mom? What about his mom? Yeah, what about his mom? Busy as well with her boyfriend.
She asked about planned pregnancy or
Yes.
were you happy with
Yes.
the
Yes.
Boyfriend's relationship with the baby.
Yes. But the good thing is, she mentioned, okay. But my point is, if someone is if a mother or a father, yeah, is showing you, if a mother or a father, guys, that's why I love interaction, because I put things, we take, I want you all the time to be alert. That's what they do in the exam. Seriously, they do nothing about what I'm telling you now. They take you here and there and they just check, are you a self doctor? Are you just following a script, biologic stenosis? Because from the first time, the first second I told her, is it projectile? Huh? She told me, is it projectile? Does it go far away? No, it's good. It's fine. But I'm saying, it's biologic stenosis. I know it's biologic stenosis. The examiner knows that you know. And the simulator knows that you know. That's why they try to challenge with what? Stupid little things. Little things. If someone is coming to show you that there is abuse there, he's not going to tell you I'm abusing my child, but he's going to show you I'm busy. Can you please give him something to stop his vomiting? I want to take him. I will admit, okay, you can keep him. You understand? He's going to show you that he doesn't care. He doesn't, that's it. He's going to show you, I don't care, like. What about his mother? His mother gave him to me. Just do anything to stop the vomit, things like this. So from you, she was even shocked. She was like, my action was shocking her that what's going on? These guys like crazy or something, So that's what, when they show abuse, they show it like this. In the eye, neglect, even a mother can show neglect like this, I'm going to the hairdresser. How long will we take? How, as a sort of abuse in the eye, neglect. I mean, as a father, if my son is sick, will I be like this? I have a date and I need to go. No, I'm worried. Doctor, tell me. But from the first second I showed her.
You don't care.
Yeah. The GMC sheet, marking sheet, has plenty of things that people get marks, but they don't know what is this finding. What is the meaning of finding in the marking sheet? The result sheet. Finding is something I'm trying to give and you didn't get. What is the meaning of active listening? Is what I do. What is the meaning? What is the meaning of the consultation? Is things I'm giving her, she's not acting on it. So my point is, it's very important. We want someone, your job as an FY2 reception desk, you are the receptionist. So your job is to take good data gathering, make sure things are okay, So in this case, it is pyloric stenosis. Forget about NAI now, because we've spoken enough about NAI, yeah? Which means I made it as NAI as well. She did the right thing, social service at the end.
How to bring about NAI questions?
No. Fair enough what she did. She said to me, brother, if you are busy and your wife is busy, don't worry. We're going to look after him. I'm going to bring the social service, look after him. Very good response. You are both busy? How? Social service. Best way. Okay? Because I will not go for NAI because the child is dying. He's having dehydration. So first, make sure he's okay. Then don't worry, social service will look after him. لو انتوا شايفين تربوا ابنكم هنعرف بيه. Social service. Look, but I'm not gonna sit here taking environmental history about who's living and the child is dehydrated. Think about it. What comes first? Exactly like a female is coming. She had paracetamol, 25 tablets, and people taking psychiatric history, and they are saying you are in the A&E. You don't need psychiatric history because you are in the A&E. It is an emergency station. Do you understand me? Anyway, let's not go into this case. Take the NAI off because I made it NAI. She picked it perfect. It's an A&E case. Newborn vomiting. Perfect. She asked about infection, fever, bowel, diarrhea, any rash. She was trying to exclude meningitis because meningitis causes projectile vomiting, fever, rash. Sorry? Yes. Trauma. Did you hear his head can cause vomiting? Yeah. Everything is negative, doctor. Then she said because he's 6 weeks, how is the birth? Everything is fine. Immunization, red book is okay. Then she asked about dehydration, birth. Yeah, because the structure for pediatric, P1, vomiting. She explored perfect. She explored the vomiting, the color of it, how many times. Immunization is at 8 weeks, guys. The start of 8 weeks. That's why when she said immunization, I gave her this look. That's why when she said development, I said to her, "Come on, 6 weeks. We don't know." But I gave her a look of, the development and these things, and But my point is, what is the patient complaint? Vomiting. She explored it well. She has asked a very important, beautiful question. I loved it. What do you feed him? Breast milk. Any new things you have given? Have you changed the way you feed him? I give him bottle feeding. Very important. Can it be a cause feeding? Yes. So things here very important. Feeding, fever, rash, head injury can cause of vomiting, and that's it. That's main things. Okay. Then go to birth triple D. Birth triple D. Most important thing. How's the birth? Full term, preterm, and dehydration. Then examine the child. Always say I will assess for the dehydration. Examination. Examine the abdomen. Then management. It's valvular stenosis, and in this station in the exam, you will have pen and paper. So draw for him. Stomach, outlet, draw it. Perfect. You will have pen and paper. Remember this word. Valvular stenosis. They bring pen and paper so you can draw for him. And then management, admit, senior, investigation. What are the investigations? Most important investigations, guys. ABG, ultrasound, plus everything else. Again, what? ABG, ultrasound, plus everything else. What would you give? Most important, fluids, and then pediatric surgeon for, sorry? Perfect. Fluids and electrolytes, correct the electrolytes. This child will have metabolic alkalosis. So please make sure ABG and ultrasound is a must. IV fluid is a must, and surgery, he will need surgery. And they will mention it like this. He will need surgery. Okay?
When you mentioned blood test, did we mention potassium levels too?
Yes, guys. Urea electrolytes, very important. Potassium, yeah, urea electrolyte. But when I say ABG, I mean when I say 2 special investigation, I don't mean that nothing else. I mean this and that, you must highlight them. But this child is dehydrated, fluid loss. We need to urea electrolyte correction, yeah? Okay? And surgery. Do you need to talk about the surgery? What is the name of the surgery? What type of surgery? Any details of surgery? No. You understand? Surgery. And then, as you mentioned at the end, environment, as you said, social services, boom, gone. Because you cannot say it anywhere else because the child is dying, dehydration. You're not going to leave him dehydrated and argue about and asking about environment and no. Fair enough, social services. That's it. Okay, because fair enough, the mother and the father are abusive, and you also are abusive by just leaving him dehydrated, yeah. And sorry,
Have to talk about it.
As she said, as she mentioned,
Because you're busy, it's not a bit like
no. She said as perfect as you and your mom and his mom, you are both busy. You can contact social services. Perfect, perfect. Yeah. But my point is, if a child is dehydrated, A&E case. Yeah, would you leave him dehydrated and say and talk and argue about social services? You're gonna mention it and that's it. You understand? Because that way you will be abusive as well. The doctor will be abusive because he's leaving the child dying and he's fighting. Huh? Yes, exactly like the case of a patient has had overdose of something to kill herself or to kill himself, and it's written in the question, you are in the A&E department, A&E, and you are sitting why and how much, and before you take it, taken psychiatric history, he's dying. You need to make sure he is stable. You remember FLAB 1? There was a very common question in FLAB 1 about anorexia nervosa. If the BMI is less than 17.5, what to do? Psychiatry. If the BMI is less than 15.5, what to do? Medical. This is exactly what they want to. If he is not stable, make him sure he's stable first. So this child, I'm not going to go into details about, what's your job in this station? Fluids, electrolytes, and that's it. Are you going to be the one who will do surgery? No, you're not going to be the one. So in this case, yes, if I added NAI to it, she will do exactly what doctor do, because his mom is abusive, his dad is abusive, and the doctor also, if he left everything, he will be abusive. So everyone will be abusive, and Yusuf, and then will end up by being all Yusuf's brothers. So
Doctor, I want to ask about developmental milestones.
Developmental milestones, if the case is development. A child, a father is bringing him, my son is not walking, my son is not talking, my son is not interactive. Forget about head to toe, forget about, and hold the word development. What do you mean he's not walking? Doctor, he cannot walk. Can you please walk me through? When did he start to crawling? Can he stand? I'm focusing on that. And then apart from this, any other problem, any other issues? Is he talking? Is he understand this thing? Is he active? Is he, you are focusing on development, and you're asking development, and I give you a very good picture about pediatric neck, buttock, sitting, standing, So then you ask about these questions. And then what about the medicine? Because BERD triple D, D development became your presenting complaint. So the structure is P1, P2, BERD, triple D. And in BERD, the D is for development. How can I help you? He cannot walk. So now development is the presenting complaint. So explore it and ask a question about development in details, supporting the neck when he was walking, when he's able to sit. And then what about the head to toe that I used to start with? No, head to toe, is he generally fit and well? Any concerns? Is he feverish? Is he okay? Thank you very much. That's the medicine part. But you focus in the development. Clear, guys? Don't go into after development. How can I help? Doctor, my son is not walking. Does he have fever? My son is not walking. Any rash? My son is not walking. Any discharge? My son is not walking. That's the wrong approach. You understand me? He is not walking. So what is your presenting complaint? Development. So focus on development. That's the station. What about head to toe? That we start with head to toe if it's a medicine. But development, focus on development. So should I ask head to toe in details when it's development? No. 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 Clear, guys?
Sir, just because she was giving breast milk as well as sir, because she was giving breast milk as well as
clear, guys? Online doctors, thank you very much. Yes.
Sir, because she was giving both breast milk and formula, so could it be some kind of intolerance, or should we exclude that as well so early?
Yes, 100%. Yes. 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 I actually give it to her for her to think of any lactose intolerance, any problem with feeding, any allergy. Yes. Definitely. So, it's a reason, diet, feeding. Yes.
How would we ask that question? How would we ask that? How would we ask about intolerance? How would we ask about it? How would the question be?
No, you say to her. You say any changes recently in the feeding. Have you added anything new to his feeds?
Okay.
Yeah. Guys, thank you very much.
Is it jargon?
Sorry?
How to mention urea and electrolytes? Because it is jargon,
no,
right?
No. The salts in his blood.
Okay. So regarding the BERD question, should we ask about the normal vaginal delivery if the child is 13 or 14, or if it is relevant only?
You can ask how was the delivery, any issues, any concerns. That is
even if the child is old enough.
Sorry?
Even if the child is like 14 years?
No.
What is the cutoff?
Look, there is no cutoff. But if the child is like 3, 4, 2, 1, few months, you do ask. Yeah. But if the child is 9, 10, 11, you don't. Okay.
If it is 9 and neurological problem,
what if the child is 10 years old coming with pneumonia? Okay. Do you ask about development, or do you ask about how was the development and how was the labor, how was delivery? You don't. But what if 9 years old coming with developmental problem? Do you ask?
Yes.
Yes, you do. You understand my point now?
Yes, only if relevant.
Yes, only if relevant. 10 years old. 10 years old coming with, for example, abdominal pain, appendicitis, for example. Do you ask about was he full term or preterm and development? No. But what about 10 years old coming with he's not good in school? For example, he's not as good as other kids. He's got problem in development somehow. You ask about problem in labor and stuff.
Yes.
Yeah. Anyway, guys, have a lovely night, and inshallah I'll see you soon. Yeah. Thank you very much.
Thank you, sir.